All right, guys, we're going to be talking about the environmental emergencies here. And again, this one I've actually split up into three parts. And the reason I've split it into three parts is the second part's actually cold emergencies. And I think that we need to go over those a little bit more intensely because we don't get too many of them here in Florida, okay? Matter of fact, usually when Floridians have snow on the ground, we lose our minds. We shut the state down. You know, again, what northeastern person would go, this is a snow flurry, we lose our brains, okay? But then again, usually those lovely folks up in the Northeast don't have to deal with 100% humidity and 100-degree temperatures for 4 months out of the year. So again, we're going to focus on the different things that cause that. Now, risk factors, by the way, usually poor the health, young and old, they're more susceptible to a heat or an environmentally related emergency. Also, if they've got predisposition, if they're tired, all of these things can play it. Medications, by the way, can throw these things off as well. So an environmental factor is, again, is considered when determining the risk for environmental emergencies, and you just got to understand the different risks for the different regions, okay? And again, we deal with a lot of heat emergencies here. And again, very rarely do we have to deal with the cold, but it's not that we don't have them, it's just the frequency of them are very, very low. Homeostasis, again, we always try to maintain that balance, and unfortunately, the problem is that when we're talking about heat gain and heat loss, again, your muscles create a certain amount of it. But remember that if it outside is warmer, the heat's going to come into our body. If the outside is colder, heat's going to lose it. The good news is we're pretty good about making heat. The problem is dissipating heat is a problem, and especially when you've got a really hot temperature outside. Remember, we have very difficulty. You can't release heat if outside is hotter than what it is inside your body, okay? There's no place for it to go, all right? So again, thermogenesis, by the way, is known as heat generation. Again, the faster molecule motion is a higher heat. Again, and the molecular motion comes to a stop as it reaches absolute zero. Yeah, it's actually nothing moves at all. The amount of heat generated in the body fluctuates as a result of the gain of the heat or loss. I kind of talked about that a little bit earlier. So remember that we lose heat by lots of ways. We can radiate the heat. We can actually conduct it, convect it. That's loss to air. Conduction is actually where we're touching an object. Evaporation is when the moisture evaporates off of our skin. It actually reduces that. And then, of course, actually breathing can cause us to lose heat. So, how do we do this? Again, and we already just talked about all those lovely things. Now, the thing is we tried to maintain that 98.6 and the steady state metabolism because we're warm-blooded animals. Yes, we tried to maintain that. So we're gonna the hypothalamus is in charge of doing that, and it increases the body temperature to create heat. And that heat increase is known as shivering. And then we can, in order to decrease body, again, we start sweating. Okay, remember, we're trying to get that evaporation process to work off of our skin here. It's usually a negative feedback system. It requires stopping or negating. So if the heat regulation function of the hypothalamus is messed up, spinal injury, that would be an example of when you could have some problems there. Now, again, at extremities, the abnormal temperatures can result in death, okay, at extremes. And we're talking about, I'd probably say above 107 or below 94 is where we're starting to deal with, that's the core body temperature, we're really dealing with issues, okay? So, again, let's see here. The base metabolic rate, your body is completely at rest. That's where it's actually the baseline, if you will. So your body will adjust this as needed to maintain the thermoregulation, okay? And again, the core temperature is where they're actually at. Now, again, heat-related illness is when the core body temperature resulting from inadequate heat loss, thermolysis, okay? And again, firefighters in particular, we're kind of big on this topic, and the reason is because, again, in Florida, we can, again, in the 100-degree heat, you're in that really thick bunker gear. All right, so heat-related illness, again, is when you're not that release of the heat that you need to get. Unusually high body temperatures, especially core temperatures. Again, we got to get these things down. Again, if you're above 105, you really need to be thinking about this. Now, what are the ways in which we can do this? Again, by the way, malignant hyperthermia, and remember, we have certain medicines that can cause that little sucker, your succinylcholine, your VEC, anything that had to do with that potassium shift. These can cause increased body metabolism, and therefore, again, it can send up the body temperature to extremely dangerous levels. Sweating, by the way, is how we evaporate it. So, again, the cooling functions that we can do is diaphoresis. They increase the skin temperature, which allows it to convect into the local air. The skin will become flush. Again, you start getting altermentation and altered loss of consciousness as that heat starts to get up. Okay, your brain doesn't function too well at about a 104, 105. So predisposition factors, again, age and the health of the patient. And again, if they're on diuretics or beta blockers, that can exacerbate the problems, okay? By the way, antihistamines interfere with central thermal regulation. They actually get a little bit colder on those, okay? So the good news is most of our firefighters down here are actually acclimated to this. If we were to bring down a New York firefighter to fight fires in the summer down here, they would probably not do too well because, again, you guys are all acclimated. By the way, vice versa. We put you guys up there in 30-degree weather, you guys would probably not... You'd be okay for one or two fires, but you probably wouldn't get... after one or two, you'd probably be spent because, again, you're not acclimated to those conditions. All right? So how do you prevent heat disorders? Okay, if you know it's going to be hot out, lots of fluid intake, gradual accumulation of being out in the heat. Gradually acclimate to it. And then, again, limit your exposure to hot environments. Kind of makes sense. And if you do get into a hot environment, move to a cool environment, especially if you start feeling the effects. Now, heat cramps is usually caused by overexertion and dehydration. Because you're also sweating, you lose the water and electrolytes, so you get intermittent cramping. The fingers, the arms start to cramp, usually the big muscle groups. The temperature is actually still normal, might be a little bit elevated, and your skin is usually warm and moist. Again, the best way to fix this, get them with sports drinks or water. Do not administer salt tablets. And again, if the patient's unable to take oral fluids, again, an IV of normal saline usually does pretty good. Risk of heat exhaustion or heat stroke, again, it can progress to that. Now, heat exhaustion is a mild heat illness, usually due to the loss of water and sodium. Again, normal saline is your friend here, but remember that you get a reduced cardiac output because of this. They're very tired. If not treated, it can progress to heat stroke. Usually there is an increased body temperature with this one, but the skin is still cool and clammy. They're still perspiring, and they may have a shallow or weak pulse because of the relative hypovolemia. Now, heat exhaustion, that guy, that one's a big one, okay? So, heat exhaustion, heat stroke is your big one, okay? And by the way, heat exhaustions, you can still get central nervous system changes, okay? So treat it just like heat stroke, okay, because it's headed there. But again, remove them from the hot environment. Water if they can drink it. If they can't, IVs of normal saline work really good. Again, remove the clothing and begin to fan the patient. Guys, convection is a wonderful thing here in this case, okay? If you've got the firefighter chairs, by the way, where you can put their arms putting cooling parts on their arms. The arms are very good radiators. The back of the neck is very good radiators. Helps dissipate heat faster, okay? Now, a heat stroke, the difference between a heat stroke, heat exhaustion, usually they got dry, red skin, and again, it's extremely high temperature, usually above 105. You're barbecuing your brain is the best way I can say it. Your liver, your kidneys are getting damaged. And again, they quit sweating. Okay, that's the big one. They quit sweating. This is an emergency. This is get their temperature down now by any means possible. Fanning, cooling, putting them ice around the patient. All of these are very acceptable. Just remember, if you do go the ice route, by the way, and I'm not saying that you shouldn't do that, you got to get the temperature down. Just be ready for seizure activity when that happens, okay? I will tell you that the I've had multiple cases of this, and priority one is to get that temperature down. They have lost the ability to thermoregulate, okay? Now, the biggest thing is you got to keep a close eye on that temperature, and as it starts to come down, maybe start removing some of those, not all of the cooling methods, but start removing them, again, if they're packed full of ice or they're in a cooling blanket. Usually these guys take a cooling blanket in order to actually get them cooled off. The other thing that might can develop, by the way, with your heat stroke is hyperkalemia. So keep them on a monitor, watch for that widening QRS complex, and again, we want to stay away from the succinylcholines. You really want to stay away from those because you thought you only had a problem. You give them that, you're probably going to have a real big problem. Guys, the ones that I've actually had in heat stroke before, a little bit of Versed, and I was able to easily intubate them. Matter of fact, the last one that I had, I literally, the only response I even got out of her is when I lifted the intubator and she went, and that was it. That was the extent of her response. Okay, so remember, remove them from the environment, rapid cooling, refrain from overcooling because you can cause a reflex hypothermia, so you got to keep a close eye on that. If you're up 106, 107, you start getting down to 102, 101, start removing those cooling processes. Remember, their hypothalamus has kind of been put into a shock state, okay? So again, monitor EKGs, cool fluids, by the way. If they are able to take fluids by mouth, you can try to have them do that, but again, usually intravenous therapy is probably the way to go. And remember that they are going to probably be dehydrated because they can become orthostatically hypotensive. So again, nausea, vomiting, decreased urine output, orange pee, brown pee would be a good example of that. Their skin turgor is horrible, and again, treat it just like you would a hypovolemic shock, 20 cc's per kilogram, and reassess and see if you need any more. If they have a pyrexia or a fever, this can also cause problems. It's usually caused due to viruses or bacteria or other substance. It's an infection source that causes it. The body, you don't really want to kill this. And the reason that I say that, that's your body making the inhospitable for the bad things. We want that actually to happen. Problem is when you're shivering like that, it starts to hurt the muscles. It does require a lot of pain. And again, so be careful about lowering fevers in your ill or your sick, your septic patient or your sick patient, because you can actually cause further. Now, if it's up where it's high, if you're not sure whether it is, go ahead and treat for the heat stroke. Just in a child history of febrile seizures, again, you might want to treat that for fever, because remember, it's that quick change of temperature that's going to cause the problem there, okay? You can leave just the diaper or unclothed, exposing the child to the ambient air. I would say sponge baths is kind of an extreme measure. And again, medications, Tylenol or ibuprofen, can be used to help reduce the fever. Just remember, you're kind of taking away the body's ability it's trying to make it inhospitable for that whatever pathogen is in there, okay? Now, that's going to stop for part one, and we'll pick up on part two with the cold emergencies. I will see you all then.